We're at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association and the Common Bridge Substack and podcast. And today we're talking with Luanne Thomas Ewald. She is the Chief Operating Officer of the CS Mott Children's Hospital, the von Voigtlander Women's Hospital at University of Michigan Health. Luanne comes to us today with a long career in healthcare and in children's health, and she's also the chair of MHA's Council on Children's Health, a very important area, of course. Luanne, welcome. It's nice to see you.
Rich, it's so nice to be with you again. Thank you for having me.
Good to have you here. Let's talk first a little bit about what you're up to in Ann Arbor with Michigan Medicine and CS Mott. What's exciting and new happening out there?
You know, we're just so proud. CS Mott Children's Hospital continues to be the #1 children's hospital in the state. This is the 19th year in a row from U.S. News and World Report, and we take that very seriously. I mean, it's looking at our outcomes, it's looking at our treatments, it's looking at our innovation, and so we just continue to try to be at the cutting edge for children's health, not just in the state, but throughout the country. And so, you know, I couldn't be more proud to show up every day at work. And, you know, our women's hospital is so innovative, and I wasn't involved. They did it before I got to U of M 6 years ago, but they actually built the women's hospital within the children's hospital. So when a woman has maybe a high-risk delivery, the baby doesn't need to be transferred by ambulance. They're transferred in a 1-minute elevator ride to the next floor. So really just, again, thinking about patient experience and what's best for mom, baby, child, and U of M did it. And so just very, very proud to be there.
And this isn't your first stop in children's health. Maybe where did you start?
It is not. I have been in children's health for, almost 34 years. I actually started, as you know, as a student intern at Children's Hospital Michigan in Detroit, and went from intern to chief executive officer. I left there in 2019 and was recruited away to University of Michigan, and so my world has been children's health, and I'm just so lucky to also take on women's health at University of Michigan. And in January, I was also given responsibility for University Hospital in the new pavilion. So now I have all Ann Arbor hospitals.
What are you doing in your spare time? Just kidding.
Oh, yeah, I'm having a blast. I'm having a blast.
So the MHA's Council on Children's Health. Happy to hear there is a focus there. And what kind of things are on your agenda or on your radar?
Yeah, so this council is amazing. I've been a chair off and on for probably 15 years. I'm turning the chairmanship over very soon to Bob Fitzgerald, who's the CEO at DeVos Children's. But what we do is we bring all the children's hospitals in the state together, and we sort of take off our competitive gloves and we talk about what is best for children in the state. So we bring in legislators, we bring in experts from around the country, we bring in the Children's Hospital Association to talk to us about things around public policy, around Medicaid cuts, around 340B cuts, around measles, around what we had a meeting just last week, and what we had talked about was, is there a way that we could all come together, because we're seeing something new. And what we're seeing is a lot of kids coming into the emergency room who have consumed edibles. Right, so that's a new thing. And so we started, actually, Bob Fitzgerald from DeVos actually brought this to the table and showed us pictures of what the packaging looks like for these edibles, and they look like Sour Patch Kids, and they look like M&Ms, and they look like Oreos, like just the packaging. So young kids are thinking it's candy and it's edibles. So we're seeing that number skyrocket in our emergency rooms of kids who have actually overdosed on these edibles that they're finding wherever. So that's a topic where, like, yes, we need to come together, bring awareness to our families, schools, to really help these kids not get in these situations. So that's just one topic that we sort of come together. We look at things like, we'll look at other organizations like Make-A-Wish Michigan. What can we bring them in and talk to us about how we can help them make sure families throughout the state of Michigan are getting their wishes if that's what their family deserves. So it's really from things from policy to community to advocacy to children's health. So it's been in existence for a long time, and it's just been a very collegial group of people. We're all here to make sure kids in our state have what they need to be happy and healthy.
Well, it almost seems like a layup when you talk about the incidences of THC overdosing. You know, we've already have child-proof caps to keep
Yes.
children away from things. We have warning labels on
Yes.
packages of dangerous things. Seems like that would be an easy win for our legislature and our governor to say, yeah, we're going to do that.
Correct.
But I think that's an issue that's flying under the radar. Has any major news area ever covered
No,
this?
no. And so we just started seeing how the ingestions were just going up, and we're like, there's no regulation around the packaging, right? And it's exactly what you said. Even Tide Pods, Tide Pods, kids were swallowing Tide Pods detergent years ago, but they put on childproof caps. They put out warnings. We talked about it. They look like candy. It's not candy. So yes, that's something we're like, let's do this together to make sure that we're keeping kids out of the emergency room.
Yes.
And healthy.
And you talk about Make-A-Wish. Is it my understanding correct that you're building a new Ronald McDonald House?
Yes, in Ann Arbor, yes. So I'm on that board, the Ronald McDonald House, Ann Arbor. And, CS Mott Children's Hospital is at capacity every single day. We're at 115% capacity every single day. And most hospitals get nervous when they're at 85% capacity. We're at 115. And so because of our growth at Mott, there's obviously major growth at Ronald McDonald House, Ann Arbor, which is across the street. And, we're pulling families in from all over the state. And so having housing options is so important. Right now, there's only 52 rooms at Ronald McDonald House, Ann Arbor. We have 375 beds at Mott. And
That
so
arithmetic's not
it
arithmetic
doesn't work.
for me.
It does not work. And so, many of our families are denied a room at Ronald McDonald just because they don't have space. And so, we've worked together to come up with creative solutions, and Ronald McDonald House has put some families in hotels. But as you know, keeping families close is Ronald McDonald's vision. And so Ronald McDonald House, not Ronald McDonald himself.
I was good with it
Ronald
either way.
McDonald
Yeah,
House.
it could be either way.
The Ronald McDonald House, but keeping families close so they can just walk across the street to see their baby if something happens, right? We don't want them miles away at a hotel. So they've been talking about expansion for many, many years, and now they're on the road to making that a reality. We're very excited.
That's very exciting. Now, this is a policy conference.
Yes.
So if you were going to think about, and there's probably dozens of policies, are there one or two that you said, it'd make it a great year if we got this done?
Yeah. So, every year, and especially I'd say over the past 12 years, we are increasingly concerned about Medicaid cuts. And so, what Medicaid is and does is it provides access to those families and those children who need it. And so it's not, it's children who may have multiple conditions. And so dad may be working, mom may be working. And we see these situations all the time. Mom or dad may need to leave the workforce to care for the child who has a chronic condition. The spouse that continues to work has tapped out in their insurance with this child who has a chronic condition, and then they flip to Medicaid. So we have a working family who's trying to get through this situation with their child, right? And the child needs multiple things. Those are the families that we see on Medicaid all the time.
They're young families. They don't have the resources. They're not in the high income yet.
Correct. And one spouse continues to work, one's taking care of the child, and the child has multiple appointments a week and is hospitalized multiple times a year.
And a policy that makes their life harder instead of easier.
Correct. And so the threat of that being cut, every couple years, that's one where I want our state to say absolutely not. Kids will be taken care of in this state, and everyone around the country come to this state because your kids will be treated here.
Well, I hope we get a generous portion in the state budget this year.
Me too.
Any final comments for our audience today?
No, I just want to thank everybody. You know, our kids are our most important asset, and children's health. I can't think of a better thing to advocate for. So, thank you for having me today and letting me talk about what I'm so passionate about.
Glad you could be here.
Thank you.
We've been talking to Luanne Thomas Ewald of CS Mott Children's Hospital and many other things in Michigan, a passionate advocate and executive for the health of children and women. And on behalf of the Michigan Health and Hospital Association and the Common Bridge Substack and podcast, this is your host, Rich Helppie, signing off.